If your injury is a tendinitis of rotator cuff or supraspinatus or a partial tear, then we can easily heal the injury by orthobiologics injections. Shoulder rotator cuff injury treatment by orthobiologics. What is orthobiologics? Friends, rotator cuff is a group of 4 muscles which surrounds our shoulder, and it can injured very frequently, and the patient complains of pain and inability to lift the arm. If your injury is a tendinitis of rotator cuff or supraspinatus or a partial tear, then we can easily heal the injury by orthobiologics injections. These injections are made from your own blood. So basically we take out your blood and separates the platelet and plasma from the blood, and then we inject the platelets and plasma and the growth factors into your shoulder. They heal your partial tear and tendinitis of the supraspinatus tendon or infraspinatus or teres minor or subscapulary muscles, thus avoiding the surgery. It is very important that the injection should be given by an orthopedic surgeon who is specialized in arthroscopy, because he knows if he is putting the injection, it is going directly into your shoulder joint. So the precision is very important. So experience of surgeon in giving the shoulder injection is a very important factor. Second important factor is what should be the dose of orthobiologics injection. So generally in my practice, we use 2 vials of orthobiologics injections in every session, and we give 3 sessions of these injections in a gap of 7 to 10 days. It is very important that we give 3 sessions of injections for the complete healing. Why it is important? Because whenever I put an orthobiologic in your shoulder joint, it starts the healing, it heals your tissue, but because it doesn't belong in the shoulder joint, the platelets doesn't belong to the shoulder joint, they move back to the blood vessels away from the synovial fluid, thus limiting the healing period. That's why we need repetition of these injections at least 3 times. It is very important that we give these injections in a very good volume, because the shoulder joint is big and we need big volume of orthobiologic injection. After the injection, it is very important that the patient should do proper rehabilitation. Specifically, if I talk about the partial supraspinatus or rotator cuff injuries or the tendinitis, we start the rehabilitation with the isometric rotator cuff exercises. Once the patient is doing isometric exercises easily, then we progress to the centric rotator cuff exercises, in which he can use a TheraBand or a dumbbell. After that, eccentric mode of rotator cuff injury exercises comes in the schedule. It is very important to incorporate the scapular stabilization muscles, particularly the trapezius lower and middle fibers. So the treatment results depends upon the precision of the injections, the quality of the orthobiological injection, the quantity of the orthobiological injection, the sessions, how many sessions and what are the gaps between the sessions, and the proper rehabilitation schedule. So friends, if you follow each and every step of this schedule properly, then you will get almost 100% result and we will save your surgery. If your MRI show that you have a partial or complete rotator cuff injury or supraspinatus injury or tendinitis, or you feel that you might have these injuries because of your shoulder symptoms like shoulder pain, restricted movements, then you can do your MRI and send us your MRI report to us, and we will tell you what should be the best treatment option for you, and we might save your surgeries very well.